Well, let's follow up on the Canadian government's response to the coronavirus outbreak. From the foyer of the House tonight, I'm joined by Darren Fisher, the Parliamentary Secretary to the Minister of Health. Tamara Jansen is the Labour critic for the official opposition and a member of the Commons Health Committee, which we should note is expected to meet tomorrow to examine the government's response to the coronavirus outbreak. And Peter Julian is the House Leader for the NDP. It's good to see you all. We've heard at length from the Minister of Foreign Affairs and the Minister of Health on Canada's response so far. So let's begin with the opposition here. Tamara Jansen, the government says it's working on a plan to help Canadians in China who want to get out of the affected areas and can't because of restrictions on commercial travel there from that area. How do you think the government is handling all of this?
Well, I think we're very concerned that there's not a lot of communication going on. I have constituents in my riding. Their daughter is in Wuhan with her husband and son. She's 8 months pregnant. She's not able to travel. If she goes into labor, she's not able to freely get to the hospital. So this is a very urgent situation. And after question period, I actually ran home, back to the office to call her mom and see, have you heard from anyone? And she says she hasn't heard anything. So I did a little piece with those constituents. Last night we did a Skype call, and I was able to find out from them a bit more, and I think it's just really concerning. They would like to have a communicated plan, and I think it's going too slow. We're dragging our feet.
Well, so let's delve into this a little bit, because the government has said today that I think it's 245 Canadians have put themselves on have registered with the Canadian Consular Services in China, and 126 of those people have made it clear they want to get home. So are your constituents, as far as you know, are they part of the 126 who said we want help to get back to Canada? Because according to the government today, all of those people have been communicated with.
Well, I sure hope they are. I think it's very, very important that Canada is making sure that everybody's accounted for. I mean, these are healthy people just holed up in their apartments waiting for the government to come and get them home.
Okay, Peter Julian, how do you think the government's handled this?
I think it's been very slow. The government has not responded as quickly as it should have. I also have a constituent who is in the area in Wuhan. There has not been enough communication with them. When you see the extent that the other countries have been able to mobilize and put in place an action plan, like the United States and France, Canada's lack of response and very slow response, I think, is quite remarkable. I'm also concerned on the other end, Peter, and that's here in Canada. We're now seeing cases emerging of the virus. I don't believe the federal government is responding as quickly as it should, particularly, I think, to protect healthcare workers. We know from the SARS virus outbreak a few years ago that it's health workers that often are mostly subject in the front lines to a virus that it seems to be as quickly contagious as this one is. And so I don't think the government is responding very quickly at either end, either with Canadians in the quarantine zone in China, but also taking the precautions that they need to with the provincial health authorities here in Canada.
I want to come back to some of how the government's dealing with this on the ground in this country. But Mr. Fisher, let's stay with what we heard today in terms of the government trying to mobilize a plan to deal with the Canadians. So far, 126 of them have said they want help getting home. What's your response to your two colleagues here who say you're not moving quickly enough?
Well, as Minister Champagne said today, it's important that if you are a Canadian, you need to register with your consulate, and you need to, we'll then take every precaution to ensure the absolute safety of all the Canadians in China.
Right, what about the people who want to get home?
Well, again, we need to have them reach out, they register, and we'll take all those steps necessary to get them
Well,
home.
120, the government said today, the minister said today, 126 people have communicated to the government. They want help getting home.
Yeah.
What's the plan?
I don't know what the plan is per se, but Minister Champagne has got this handled, and we are going to make sure we can get those Canadians home.
All right, Tamara Jansen, are you confident in that?
That's a little bit shocking. I mean, this is extremely urgent, and we really need to get these people home. So to not have a plan yet after all these other countries have managed, I know my constituent said it feels like Canada is 5 days behind everybody else. So we got to move forward, and we got to move fast.
Do we acknowledge there are challenges there? I mean,
absolutely.
I mean, how do you, it's? I mean, commercial traffic I think has been shut down out of 18 airports in the affected areas. So, how easy is it to? Presumably, this would have to be, I guess, a military flight of some kind. We'd have to get a plane in there, get approval from China to do that. How quickly can that happen?
Are you asking me?
Yep, go ahead, finish, and then I'll get to Mr. Julian and Mr. Fisher.
I'm just tremendously shocked that we wouldn't have at least that little bit of information of what are the options. I know I heard that they were looking at options. Well, what are those options? I would love to hear, what are the plans?
What about you, Mr. Julian?
I'm stunned, Peter, quite frankly. I expected that the government would have answers this week. They obviously still do not have any answers at all. This isn't a bean counting exercise where you can count up, we've had 120 people phone us, so we've succeeded in some way. This is an emergency situation where Canadians are at some risk, and there are ways that Canada can organize, but Canada can also work with countries that have been a lot more adept and a lot quicker in the response. For example, the United States. And there hasn't been any sort of outreach from Canada to say, in the case of the United States, if they're evacuating citizens, for example, can Canadians be part of that evacuation
Piggyback
effort?
on a flight.
Yes. I mean, I am stunned with the lack of response by the government, and they seem to be patting themselves on the back for having done nothing but open the phone lines so that they can find out how many people are impacted.
What about that, Mr.
That's
Fisher?
a very first step.
Would it be reasonable to expect at this point that we would have heard from the government today saying, here's what we're doing. We've lined up a military flight. The government did say they're in constant contact with Chinese officials, trying to figure out what the plan will be, I guess, when the plan is put together and how it'll be executed. But is it unreasonable to think that by now we'd be hearing about a plan, that there's a military plane on standby, ready to go, and so on?
Well, Peter, the level of cooperation between all the countries, all the organizations, the World Health Organization, the level of cooperation and coordination on this relatively new case has been unfounded. 2003, we were nowhere near this. We didn't have this level of cooperation. We didn't have this level of collaboration, and this is a different world from the days of SARS. We've learned so much from that, and we will be putting a plan together to make sure that we ensure the safety of all Canadians.
But the comments from your colleagues, do you know if either the Ministry of Health or presumably the Ministry of Foreign Affairs, I guess maybe Ministry of Defence, has been reaching out to other countries to say, look, can we get some Canadians on your plane? They want to get home. Can we? Do you know what's being done?
Again, the level of collaboration between these countries is working very, very well, and there's a plan in place to move forward to make sure that we ensure the safety of all these Canadians.
Peter?
Yeah, go ahead, Mr. Julian.
The lesson from SARS is rapid response. This is a virus that can be very contagious and be transmitted very quickly. And we've seen a government now that has been dragging its heels for well over a week. They obviously have not learned the lessons of SARS, and I'm actually more disturbed hearing this interview than I was before. I assumed that there was some information the government would give out at some point. It just seems to me to be a catastrophic meltdown. The government seems to be more inclined to give talking points than actually do something to help the Canadians that are in China and to protect Canadians here.
So,
if we've learned so much and there's so much collaboration, we should know something by now of how some of our options. How are we getting some people home?
So Tamara Jansen, you talked about, and Mr. Julian did as well, but you've got some constituents there. You've been in contact with them, yeah. Tamara Jansen. Have you gone to the Minister of Foreign Affairs or the government side today to say, look, here's how to reach them, here's where they are, they want your help?
I'm going to have to do that right now. So as soon as we're done, I'm on my way.
Okay, let's talk about what's happening in this country then. And Tamara Jansen, let me stay with you. What concerns do you have about the screening process? I know that members of your party have raised some of these questions about whether the government's doing an adequate job or public health officials are doing an adequate job at airports, for instance, of making sure people are properly screened.
Well, I think we're not watching as people are coming off planes. I don't see people wiping down railings. I mean, we know what happens on cruise ships when we don't take care of these things. It's so important that we actually learn something from what happened last time and actually make changes. So, I mean, like I say, a simple thing like wiping down railings in the airport, like we have to move forward.
Well, I mean,
fast.
what more should be done? As far as you know, do you think that every plane arriving at a Canadian airport from a Chinese city, that all those passengers ought to be taken through a separate screening system?
I mean, at the
they
very
should all
least,
be checked, or?
At the very least, as they're walking through, we should be checking temperatures. It's a very simple technology. It's not that.
Health Minister said today that's been proven that it's not effective. That it doesn't necessarily tell you whether someone's sick.
It's more than nothing.
All right, Mr. Julian, what about your views on this? I know you've talked about health workers. Is there more that
yes.
needs to be done with passengers arriving from China at Canadian airports?
Well, I think it's making sure that all the healthcare facilities actually have what is required for rapid testing and making sure that they can detect cases. We just heard in the area of the Lower Mainland a case of a person who went into a healthcare facility in the Lower Mainland of British Columbia and was not diagnosed and was only diagnosed when he traveled back to Shanghai. And so there is a big disconnect. We're certainly seeing this from the Ministry of Foreign Affairs. It's devastating that there's absolutely no plan in place. But for the Minister of Health, I don't get a sense on the ground that they're taking any measures either. This isn't about talking points, Peter. This is about taking action and making sure that things are provided for and that we can have people that are symptomatic and yet not be diagnosed in a healthcare facility is very disturbing. And so these are the kinds of things. This should be treated as an important initiative right off the top, and the government should be on top of it. And instead, the government just seems to be putting out talking points.
Okay. Mr. Fisher, will you be at the Health Committee meeting tomorrow?
Yes.
Okay.
At 3:30 tomorrow afternoon.
Are we likely to get some more details? I think who's going to be at that meeting tomorrow in terms of government officials and public health officials?
I'm not sure who the government officials who are going to be there tomorrow. Today we had our first general pre-meeting of the Health Committee, and tomorrow will be the first official committee meeting. So I'm looking forward to that and getting the work started on this project.
Oh, okay, and so is there a good chance we'll have more answers about the government response tomorrow?
I would say there'd be a very good chance.
Tamara Jansen, do you know who's going to be there, and what do you want to ask of them?
Well, I know I'm going to be there, and I'm going to be asking them how fast are we going to get our people out of there, because it's very important that we get our healthy Canadians out of this situation.
Okay, Mr. Julian, let me give a final word to you. If your party was running things, what would you be doing differently here?
Well, Don Davies, who's our health critic and, of course, the senior member of the Health Committee, will be asking a lot of tough questions tomorrow to officials. But you need to treat this as an emergency and make sure that the ministries are moving forward on an action plan, not just counting heads and saying, gee, we've accomplished something because we know now that 120 people are under threat. We should be doing something for those Canadians in China, and we should be taking precautions in Canada. And I right now, don't see either of those actions happening.
All right. Thank you, all three of you, for your time tonight. We'll continue to follow the story. Thank you.
Thank you.
Thanks.